Hello students, we will discuss a condition with what are the differential diagnoses. See that in both cases different patients, see that there is a swelling in the forehead, very well localized. Similar swelling, similar place but little more above actually, and opposite side. What this swelling, of course you have to do proper examination, warmness, tenderness, duration history you have to ask, skin free or not, mobility you have to check, or fixed you have to check. Accordingly you should have a diagnosis. You can have a diagnosis. But overall look at this, what are the differential diagnosis comes in your mind, you should remember. So sebaceous cyst, common thing. Dermoid cyst, again common. Osteoma, uncommon, but definitely occurs in this area, it is very common. It is seen commonly, osteoma is common in the skull and flat bones. And lipoma, universal tumor, you know that anywhere it can occur. Commonest benign tumor in the body is lipoma. Neurofibroma, again from the nerve. So analysis all these differentiating features of each. So sebaceous cyst, I am not going to detail it, you can always go through my clinical methods in surgery, SRB methods in surgery, current edition, it gives a detail this one. No, sebaceous cyst is from the skin extended into the subcutaneous plane, molding sign is the typical, punctum will be there often, skin is not free, it is mobile in all direction. So common in the face but not seen in the palm and sole. So dermoid cyst is it is a congenital one, even though it presents in the second or third decade like that. So it occurs in the suture line or line of fusion, where it's a type, the sequestration type of the cyst actually. So skin is free here, mobility may be restricted, bone erosion is usually by the palpating finger is common, and common in the skull. It can occur in the midline anywhere, back, midline here, suprasternal area, anywhere it can occur. So CT scan of the part should be, and erosion can occur, especially in the orbital region, skull elsewhere. So in such a situation, and excision should be done under general anesthesia. Avoid doing the procedure under local anesthesia. But sebaceous can be extracted always under local anesthesia. Osteoma, it's a deep, non-mobile structure, hard in consistency. It is one of the benign tumor arising from the bone. There are so many types of osteoid osteoma, ivory osteoma, all those types are there. So you can always go through book, my clinical book and manual to find out what it is, but it's not that common like cyst, sebaceous cyst and dermoid cyst. Lipoma is very common, universal tumor, but slip sign is common, soft, smooth surface, soft consistency, skin is free, mobile in both directions. So universal tumor, otherwise ubiquitous tumor, it is called up. Neurofibroma, it is firm, often some tenderness will be there, pain will be there, and mobility is only one direction, perpendicular to the line of the nerve, neurological nerve, line of the nerve, perpendicular to that. So that is a neurofibroma. Some tenderness will be there in the neurofibroma. Cutaneous neurofibroma, skin may be adherent there. So that is a differential diagnosis. So these are the common differential diagnoses you have to remember. You should know clinically how to differentiate features each, so that give a conclusion, this is probably this diagnosis. So you have to know features of each so that you can clinically tell. So you should know how to examine a swelling. So also to give a differential diagnosis. So any swelling comes, list of differential diagnosis, have a proper clinical feature, correlate, then what it could be, and finalize the diagnosis. So this will exactly will go with the examination and conclusion of any swelling, especially in the surface swellings in the body. For that, go through my clinical methods in surgery, swelling in detail, it is discussed how to examine with the video. Of course, all other clinical examinations done properly with the differential diagnosis in the video, and with the instrument, X-ray specimens also. And go through my manual surgery in detail, all topics are there in detail, surgical related topics with very good understanding. And operative surgery gives a clear operative procedure. My digital lectures covers everything in detail lectures, including clinical examination, all topics, surgery, everything for UGC, CBM syllabus, and PGs also it is very helpful with the instrument, X-ray, specimen, specialties basic also. So student, I hope you understood how to go about differential diagnosis for a case of swelling. Thank you very much.